Jambo and good morning. Welcome to BizCheck. This show, we want to focus on medical tourism, and I want to throw some statistics around you because when you're talking about an industry that is valued at about 50 billion shillings, 50 billion US dollars. I got it wrong. 30. This industry is expected to double in terms of growth, with numbers expected to be 100 billion US dollars. So you're not talking about by all means. And the numbers currently stands at about 29 million people always on the move on medical. And so Kenya has been on an aggressive push to try and make it a regional medical tourism hub. What strategies do we need to put in place to ensure that and surpass? And also we shall be discussing the trend in the real estate industry. The number I'll be sharing with you what they are talking about. And remember, Kenya, the government has also been very aggressive in pushing for the affordable housing. What you forget is that the affordable housing agenda is not a Kenya Kwanza administration agenda. No. It is a party agenda, which was crafted back in 2008. I'll be telling you more about these. And of course, remember, the Constitution also talks about, affordable and accessible housing rights for all Kenyans. These are the topics that we shall be discussing here. And remember, around, they are tracking what's happening, and we shall be crossing over just to get a glimpse of what's happening in the county around you. My name is sure that I'm in business when you see me, because this is BizCheck, and I have my team of experts in the studio. Who am I talking about? He's a general manager, managed Medicare. He's joining us on the show. Thank you very much indeed, Martin, for your time. Edwin, for your time. Edwin, we have Dr. Ernest Mureithi. He's a head of doctors at KBC. Thank you very much, Dr. for your time.
Thank you.
You're not on strike?
No. Not at all.
You on strike? Your colleagues are on strike.
Think about that because
right.
we are in the private sector. So
fantastic.
Yeah.
I want to start here with Kegode. I mean, you've been in the medical field, and especially more in for the longest time. When we talk about medical tourism, what exactly are we talking about?
Okay, would be considered as an opportunity where somebody or a patient who desires medical attention chooses to travel. Attention, mostly driven by specialized care or the desire to get better outcomes. Yes.
Do they choose to travel, or they
in the words of medical tourism, you would consider that they choose to travel, but when you look at the broader sense of medical tourism, that force people to travel to get medical attention.
I still want to pick your brain on that issue. I mean, you have a situation whereby, expertise that you need is not available in your country, and therefore the only way you can access this is by traveling. Medical tourism, when you're forced by circumstances.
I would say that that would then be medical for specialized treatment, but not very much in the sense of medical tourism. But the broader word tourism or medical says both those that are going out voluntarily to seek medical care or medical checkups, but as well those who are also forced by circumstances to go and get medical attention elsewhere. Yeah.
I want to hear this from Dr. Ernest. I mean, the field of medical tourism, and Kenya has been on a campaign to try and market the country as a medical tourism hub. Of specialization, do we see a lot of patients coming in from into the country for?
Thanks a lot. I think I'd like to begin by saying is already a center of medical tourism, because medical tourism is a term that is to refer to the pursuit of medical services, usually specialized care. We sometimes see people Some people come to Kenya from another country to pursue wellness checks, but most of the time it is the pursuit of specialized that drives people into what we loosely call medical tourism. And so it is understood that specialties are oftentimes not available in their home countries, like cardiology, or pediatrics, and other specializations like women's health, or subspecializations where they come for specific surgery, intestinal surgery, and across the board. So it's not limited to a few specialties. It's usually when that's in their home country, then they pursue that specialty in another country, which is what we often see at current hospital, and I'm sure in well. Now, the connotation of tourism means that when done with medical care, where they will not just come to current hospital, for example, and go back home, but there will be an amount of tourism before they return back to their home country, either them as a patient, and if they are not able to, probably their relatives who often come along with them. Usually multi-specialty, but the pursuit of specialized care outside of their home countries. Yes.
I through the Kenya cancer management policy. I mean, it talks about establishing Nairobi management in the region, and we have seen the establishment of institutions like Kenyatta University Teaching and Referral Hospital, if I get how is this expected to plug into this agenda of making Kenya a medical tourism hub?
It's all about centers of excellence. And again, I say there are buckets of specializations, cancer being one of them. Now, oncology, which is the medical term for different cancers, and cancer can affect any part of the body, is the availability of the oncologists, which we have at current hospital and are also available in other hospitals, and also the availability of facility to be able to manage that cancer care. We have seen growing trends of cancer across Africa, and therefore that is why the interest to develop cancer or oncology rather, as a major specialization. It has significant life effects because it sometimes cuts short the life of a patient if the population can get affected. So oncology is definitely a major specialization that we are building, both from the government perspective as well in terms of offering more and more specialized care in oncology.
Kegode, from where you see it, I mean, I know the insurance sector, you know, is in the medical tourism because, I mean, let's face it, it's an expensive undertaking. Has the Kenyan insurance managed to plug into the growing medical tourism?
Right. The sector has been able to respond to the growing need for medical tourism. That is both inbound, when you consider, and also outbound for those services that may not be available in Kenya. For example, ourselves to have very robust relations with service providers outside the country where we support our clients and our members who seek medical treatment available. So being able to respond to medical tourism in that sense. In terms of designing the medical schemes, we are now seeing to hive off overseas evacuation as a service or as a benefit to members. Additional way in which such services were available within the primary medical cover of a member. And therefore, if a member had utilized part of their and it reached a point or reaches a point where this member requires treatment out of the country, then really reduced. But now we are seeing more of separating local benefit and overseas benefit such that when a member requires, they can get it. I think one of the foremost schemes that has been able to do that is the Teachers Medical Scheme that offers the teacher to go out and seek care if that care is not available out there. But looking at the flip side also is the local road and air evacuation part into allowing members who may find themselves outside of the jurisdiction of Kenya and they need urgent, and we have the opportunity to evacuate them back into Kenya so that they can get the necessary services. So in a sense, I would say insurers are moving away from traditional way of managing health benefits and giving broader benefits to members.
When we talk about, and I know this has always been a challenge, I mean, because when somebody is traveling outside the country for means that this is specialized medical services, that are needed. And I know insurance, they always to save a coin where it's necessary and where it's possible. And so for me to be covered for an outside the medical cover, what do I need to do as a Kenyan?
Access medical benefits. One can access medical benefits through employer-sponsored schemes or through, direct purchase of medical cover as a private citizen. When one is seeking for medical cover for the HR practitioners or the finance managers that are designing these schemes and engaging with insurance companies do those kind of benefits to be incorporated into their scheme so that when the need arises, then the members have that bargaining power over an employer scheme is much higher. But having said that, even when you purchase insurance, private medical insurance cover, then having that information helps you to be able to negotiate to incorporate that within your policy so that when that need coverage out of the country, not to look down upon the facilities that are there locally. We have also great capacity in country, as has been shared by my colleague here, and so the need for overseas treatment is reduced. When that requirement is there, you need to have coverage. Locally, we see hospitals, Kenyatta University Teaching and Referral Hospital, and other hospitals locally which are now equipping themselves to manage people desire to go out of the country more, and that then builds up on the need for people within the region or patients within the region to come to Kenya as a hub for medical.
And before you approve as an insurance company, before you approve or you authorize a patient to travel outside the country, what factors do you consider?
Primarily, the need for medical attention, the fact that the treatment is not locally available, or if locally available, the outcomes are not very great, and experience working with various medical schemes, and over time, we have built relationships with service providers, medical service providers, where we know are centers of excellence, and therefore, that becomes one of the considerations. If treatment is not locally available, then the patient gets an approval to go and get treatment out of the country. If the same treatment might be available locally, are not very good, and we can demonstrate that by statistics that the outcomes are better elsewhere, then again, we may make a consideration to facilitate that patient. In that case, also saving costs, because sometimes you find that they are competitive.
And when you say that, what do you exactly mean when you say the outcomes are not very good in this case?
I think the doctor here would be able to share.
This is what you are saying.
But I would say that there are growing specializations in country. We have not had as much experience with some of those. We are getting more doctors offering those specializations in country, and then they manage those conditions. Cancer is one of the leading reasons why people go out of the country know that cancer treatment is now locally available in quite a majority of the facilities, but there's protocols that may be available in other territories that may not have reached us yet, and therefore we may recommend a patient to get attended to out of the country.
I mean, you have locally available medical expertise to treat a certain ailment. The equipment are there, but you have a situation whereby a patient accessing that service locally because of diverse reasons.
It's important also to note that we play a critical role in ensuring that our medical capacity locally, and so we respond to the need for people to get medical treatment, also develop the expertise. In the process or that you come across such a patient, possibly the reasons that are driving that thing, what you may see on the surface, and so there's a lot of counseling that is done to be able to support that patient and also get doctors' opinions that will drive decision making, because as we know, treatment outcomes are better when you're closer to your relatives more than when you're far away from them. So some of those reasons, attention of such members, and we've seen people who have taken the decision to still locally, as much as they possibly had different opinions.
I want to bring on, when you talk about an ideal medical tourism destination, what are the bare minimums?
And remember, it goes back to those two terms, huh? Medical and tourism. When it comes to looking at outcomes, for doctors and hospitals, we are all about outcomes. The patient and has to go back to their normal life. That is the ultimate outcome. Because if they don't resume their normal life, then we call that an inadequate outcome. So on the medical side, outcome, the patient has to get well. Then on top of that, it is the desire, for example, when a patient does get well, that they also get to support the tourism in the nation, rather than being discharged from hospital today and you're on a flight back home tomorrow. Help if you would pass by Masai Mara and see a few animals before you go home, and therefore you support the tourism industry and you support the medical industry. Now the two components are separate yet together. Work on the outcomes, but the hospitality people are also all about giving our patients a good experience of in the country when the patients are here and their relatives. So those two industries work hand in hand. Yes.
And when you look at, statistics worldwide, I mean, 71% of medical tourists open heart surgery. Then this is followed by stem cell then you have kidney transplant and so much. And when you look at, medical tourists to care, drive them to this country?
That's a good question. It's more. Of course, the number one specialization around the world, including Kenya, that people come to Kenya for, that in hospital, is cardiology. And that is different aspects of cardiology and cardiothoracic surgery. That, even for us at Current Hospital, it is our number one specialty. It's what we've been known for. The second one that people travel, the heart.
Yes.
Yes, and the difference between cardiology and cardiothoracic is the cardiology is the external treatment and cardiology in a surgical procedure. But those two become the main drivers of medical tourism. Brings a lot of medical tourists to Kenya and even to Current Hospital is oncology. And I did mention that. And so a lot of cases do come from abroad. The third one is orthopedics. People
from
come
abroad.
outside Kenya.
It
Meaning
doesn't have to be Norway. It could be Burundi.
It could be. I mean, majority of tourists who come to Kenya are actually from Africa. But we do have also patients from the Western countries come well. And he says we also have outbound patients who leave Kenya and go for care elsewhere. Specializations of cardiology, cardiothoracic, oncology, orthopedics, those are the main drivers. We especially pediatric cardiology, interventional pediatrics, for example, born with defects in the heart. Which again is another specialization we do quite well at Karen Hospital. That also drives parents a lot to come out if those services are not available. Sometimes, like you said, the services may be available in their home countries, but they still make a choice outside the borders and come to Kenya for the service. And usually that is driven by, one, there may be a relationship with a certain doctor. The patient and the family may be pursuing a specific doctor, where they know this particular doctor has more years of experience. I may have a cardiologist in my home country, but I would like to go to a cardiologist in Kenya. Those are voluntary choices that are made but that whole concept brings a lot of benefit to the country that is hosting the patient, because we hospital, but even as a country from multiple industries.
And when you talk about building a strong medical tourism, question of one hospital.
No.
It is a question of a well-supported industry, whereby services is not available at Karen Hospital. I can access the same at Kenyatta National Hospital.
Yes.
If Kenyatta National Hospital is not offering MP Shah or Aga Khan Hospital. And so, as an industry, do you have a platform where all of you converge to see how you can strengthen these sectors of tourism and medical?
Yes, definitely. Hospitals do work together. We exchange patients, we exchange services, we exchange doctors. And to give you an example, one of the specializations that we at Karen Hospital offer that other hospitals don't offer is a procedure called ECMO, extracorporeal membrane oxygenation, which is oxygenation in the blood outside the body. Now we another hospital and then send the patient back to that hospital. Similarly, in return,
sounds like it's very complicated.
It's a very complicated procedure.
Because I can even
Please to say it again.
It's ECMO, ECMO, extracorporeal membrane oxygenation.
Okay.
And it's a process that we do, and other hospitals may also have other complex procedures. Basis, we work together hospital to hospital based on the capacity of each. And we exchange patients, both who locally based and also those who come from other countries. We also deal very closely. At the end of the day, we are governed by the Ministry of Health, and they support all hospitals, not just particular ones.
Policy and
they also support on a daily basis. If we need, for example, to get certain specializations from in that initiative, so they are also a partner in how we develop the hospitals, because each hospital tries its best to improve the specializations, because it keeps changing. Remember, medical is stay the same. The way we used to do an open heart surgery 10, 20 years ago is not the same today.
Very different.
It's very different. The equipment, the same equipment now. The technology keeps changing, so you have to keep upgrading your equipment. The doctors have to keep going back to school and more newer methods of training. So it's a constant growth process, but a very collaborative process. But behind that is then the payer. In fact, we were discussing before the meeting about how hospitals and payers. Minet is a very close partner to Karen Hospital, and we serve their clients significantly. And many of these decisions to send patients for medical function between the payer and the insurer and the hospital. Yeah, so it's a very collaborative ecosystem.
Yes. Kenyan medical landscape. I mean, and granted, I mean, medical equipment are very expensive.
Yes.
You know, I saw one of the hospitals in Kenya, I mean, advertising that they have, I don't know, what is a CT scan or and they were talking about one system costing about 1 billion shillings. And I was like, whoa, that's very expensive.
Yeah.
And for example, the availability of specialized equipment in this country, would you say that we have all the necessary for diseases?
I would not use the word all for all, because remember, medicine is very wide. It is very difficult equipment to cater to every single type of illness.
Even for any country in the world?
For any country in the world. The rich nations, it's just a few hospitals, for example. You wouldn't go to a very rich nation and find every hospital having every equipment. Equipment are expensive. Kenya does have a significant number of very advanced technology. Like I told you, we have the which is very significant and very technologically capable and very advanced. Other hospitals have PET scans and other types of equipment. Process that grows. Kenya has grown significantly over the last 10 to 15 years in terms of the ability to provide sophisticated medical of hospitals. It doesn't cover, of course, 100%. It's a continuous journey of improvement. Even us as current over the next 5 years to introduce more and more equipment. Even the ones we are currently using are also changing. The MRIs of today will not the MRIs from now. So it's a constantly changing landscape. Yeah.
And let's now bring on board Kegode here. When you get those pre-auth requests from patients, and I'm sure you go through all of them, top reason why patients would want to seek medical attention outside the country?
As I said earlier, that reasons. So they go out for oncology treatment. An interesting contribution from my colleague here. Now have hospitals that are equipped with PET scans. I think the Kenyatta University Teaching, Referral and Research brought in the PET scan, and a few other private hospitals. This was one of the other needs that patients required to go out of the PET scan. So just contributing to what he said, that we are now getting more equipment locally, but yet one of the leading reasons why patients would want to go and seek treatment out of the country, in addition to the other conditions that we...
So before you sign that pre-auth form, do you first of all recommend that they seek that service? You know, for example, at Kenyatta University Hospital, I also know Aga Khan, they have a PET scan. Do you first of all advise them to seek that medical services there?
Yes, indeed. Requirements in the process of making a determination whether this patient does qualify to be taken out of we do not want to contribute to the exchange rate in dollar flight and stuff like that. But beyond that is that the ministry has stringent processes also to transfer a patient out of the country. The patient would need to get authorization from services. And it's at the ministry that all this information sits. Hospital A has these capabilities. These are the number of specialists we have in country, and so they'll run that through that process to be able to make a determination whether indeed the patient to go out of the country. So indeed, during our pre-authorization process, that's one of the key steps to be able to check with the Director of Medical Services before now we can process further a patient to go out of the country.
Dr. was raising a very interesting question, I mean aspect of medical tourism, whereby, I mean, it's a one of them is medical and the other one is tourism, whereby it is expected that upon recovery, you take time to visit downtown Nairobi and experience the cultural experience there. Is this part of, is the also covered under the medical scheme?
I think tourism becomes a matter of choice, that if it's enough now to take a walk downtown and do some shopping or buy some curios or visit the national park or for those inbound patients. When you take patients out of the country, one of the key benefits that we have been able to incorporate is transportation out of the country. So the aspect of accommodation then feeds into the local tourism or hospitality, because it means most likely you find patients who may require treatment, long-term treatment, go check into hospital, attended to by the doctor, and have to go and recuperate and come back for reviews or for further procedures. During that period, they are able to contribute to the local tourism by, hospitality and possibly touring the local towns. So indeed, it is not a direct benefit that we give, but it plays a part to contribute to the...
Mm-hmm. And I want to hear this from Dr. I mean, when you look at the African continent, South Africa, leads the number of inbound medical tourists. This is followed by Egypt. You have the likes of Seychelles, and also Kenya is part of the big 10. So why does South Africa Kenya?
It all boils down to the availability of specialized services, as well as equipment, as well as hospitals and doctors. So South Africa, so it has available a lot of these services that we are growing into. So they would have what I would call a head start, but they have a lot of these specialties and multi-specialties that we don't have here. And so when
why
patients...
don't we have them? I mean...
It's a question of time, because, for example, like I told you, if we were having this conversation 20 years ago, the conversation we would in Kenya. Today we are talking about more than 5 in the country. So with time, as
why is it so special?
it's a good diagnostic equipment, and it's something we used to send patients a lot. In fact, one patients a lot was for simple PET scanning. And that's why hospitals invested, including Kenyatta University Hospital, because it's an important diagnostic tool measuring oncological progress in a patient. But there are many other pieces of equipment that are involved in that South Africa has. Kenya will get there. We are not where we used to be. Yeah. We may not be at the level of South Africa yet, deliberately, but I know at the rate at which I see hospitals in Kenya growing, it's only a matter of time before we are able to be at par with the market leaders.
And Kegode, before we take a break and listen, I also want to hear from you. I have had these, from many people that medical insurance in Kenya is expensive compared to our, your peer countries, and like South Africa, Egypt, Morocco, Tunisia. Is this true?
Not true. I would say medical insurance premium is a factor of the cost of medical care, and I don't think statistics we see is that our medical care is modest. The cost of medical care is modest. Specialized services or cost us much more, but basic medical treatment or primary health care, which is an area of focus, is quite... maybe what I would say is that the insurance penetration plays a part in the cost of insurance. Many people are purchasing insurance beyond the employer-sponsored schemes by the government for people to move into SHIF possibly, and getting them acquainted with insurance matters will develop the need for people to put aside some money and pay for insurance. So in a nutshell, are quite competitive. And the second factor is that the insurance rate of cover that one is purchasing. So if we took a benchmark between South Africa and Kenya, I think we do. South Africa actually has slightly higher rates, maybe driven by the fact of the medical services that their country.
Very well.
Yes.
We are back in studio. We're in a good company of two gentlemen. We have not doctor, but Edwin Kegode. He's the general manager for Managed Medicare, and Dr. Ernest Mureithi, who is the head of doctors at the Karen Hospital. Our conversation this morning is around medical tourism. We have about 15 more minutes to go. I want to hear this from Mureithi. When you look at our policy and regulation environment, is there anything that we need to do on that front that will help drive medical tourism in Kenya?
Good question. Already, the government is a very big supporter because when we need to upgrade our medical services or buy equipment, it always facilitates. The government does not come in the way of growing the specialization. Secondly, we are able to send out doctors for further training and specialized training, and our government is very supportive in that particular regard, because the growth of medical tourism will come when three things keep improving: the skill of the doctors in various specialties, the availability of technology and equipment to provide that care, and of course the provision of other auxiliary services like laboratory, pharmacy, and other areas. Now, these three are constantly evolving and constantly growing, and therefore the more that our government supports both public and private sector in getting these three things aligned, the more we are able to specialize, the more we are able to provide more specialized care to patients, and the more we are able to invest, because remember, medical is also an investment. We buy these things and we spend to train doctors. So the more the government supports that, the better. And the easier it is for hospitals, both public and private, to become more and more specialized. And when we become specialized, we are then able to offer that service to more and more countries. The other part that, and I always refer back to the tourism aspect, because for that patient to come, say, from Uganda, remember they have to travel here. So you're looking at border controls. How easy is it for that patient to come here? How easy is it for them to find accommodation? Because rarely does a patient come for specialized care by themselves. They will tend to come in the company of family and friends. And so the government plays then a big part in making it easier for these patients to come into the country, to stay in the country, and find whatever else they need besides the medical care. So it's still a two-pronged approach, but the government of Kenya has definitely done a good job in this area and continues to do so. And so it continues to be a strong partner for us, both on the tourism side and the travel side, because there's a travel. The patient has to travel to come here. But the easier it is for patients to access the country, the easier it is for us to develop our specializations, the easier it is to grow the industry as a whole.
We have seen, a deliberate effort by the government to try and make movement to Kenya easily, and we have also, part of these reforms, we have seen a government introducing an electronic system, whereby you can just log in, enter your details, and you get your authorization.
Correct.
In the next couple of minutes. And this is expected definitely to ease travel to Kenya. Have you seen any impact of this yet?
Not quite directly yet, because we still have, remember, most of our incoming medical tourists are from areas where already travel barriers were already removed. And I talk about the East African region, which is the largest provider of patients coming into the country for medical care. However, the wider initiative to make it easier for any country in the world, any citizen from any country in the world, to access Kenya will further improve that. That increases the scope. It increases the net of capture in terms of patients, whereby we may be finding it easier for a Ugandan patient, for example, to travel to Kenya. It may be more difficult for another citizen from another country because of visa regulations. If those regulations then are harmonized or made easier, then that patient then can come to Kenya. So these initiatives are very good because they will allow more and more traffic into the country, not just for tourism. People again, many times we support tourism very well, but when people are able to come into the country easier, then they can access more services, not just hospitality, but especially also medical services. So that's definitely one initiative that will directly impact medical tourism.
Kegode, I mean, we have seen a situation whereby yes, as a country, you invest so much into your medical field. You know, you have very good trained doctors. You have specialized centers, and so the infrastructure is good. And then you end up with an influx of visitors, you know, who are seeking medical services at the expense of the local population. Are there any safeguards that needs to be put in place so that we ensure that even as we attract more visitors from outside our boundaries, then we also do not neglect the locals who cannot afford to pay top dollar for medical services?
Yes, indeed. The first primary safeguard is that any visitor that is coming into the country needs to demonstrate that they have a medical cover. This is a requirement that we see as visitors travel out of Kenya to other countries. When you visit the other countries in Europe or in the Americas, you're required to demonstrate that you have a medical cover so that you do not burden the citizens of that country with your medical expenses. And so that is one of the safeguards that is readily available, where we can then require that whoever travels into the country demonstrates having a medical insurance cover from their country that extends to this country, or that they purchase a local cover that then can facilitate them while in the country should there be need for medical attention. And therefore it means when medical bills arise, then they have a cover that will be able to take care of that and not then strain the taxpayer to meet their medical expenses.
Yeah. And what trends are likely to drive medical tourism in Kenya in the next 5 years, you know, when you look into the horizon?
I think one of the things that we see a great number of times is that we have interactions with medical insurance providers, with the medical service providers. These are hospitals and clinics and medical centers. What I see is that more and more are these hospitals graduating from one level to the next level. So as we are getting more level 3 hospitals converting to level 4 hospitals and getting in more specialized services, then it is going to open up opportunities for people around the region to be able to come into the country to get the necessary medical services that they may require that may not be available in their country. So I think the growth of medical providers graduating from one level to the next level, improving service provision, is going to be a great driver. I was just reading an article not too long ago, and in this article, one of the critical things is doctor to population ratio should increase. So training more doctors and training more medical personnel does not just end with the doctors, but including the auxiliary services that are going to support the doctors in the provision of services. Nursing care, for example, having more specialized nursing care, because that's where health delivery is given. As we increase that capacity, then we'll be able to drive more people into our country, because we notice that in the region we are a front runner in health.
In this field.
Yes.
Very good. Let's get back to the studio. We're almost winding up our first conversation. Our first hour is almost done. We are talking about 10:56, and we should be out by 11. The conversation has been around medical tourism here in Kenya. We've been having a good conversation here in the company of a doctor and an insurer. And now I want to turn my focus on to Dr. Ernest Mureithi. He's the head of doctors at Karen Hospital. And I want to find out from you. I mean, he's really talked in length, you know, what is expected, the kind of shift that the industry is expected to take in the next 5 years. But from a medical a professional platform, where do you see this industry going, and what will shape this development?
Yeah. In the next 5 years, you're looking at, again, from a hospital perspective and from a doctor perspective, there is always the push to improve on the skills and ability to provide more and more specialist care across more and more specializations, not just one or two or three. And so in this country over the next 5 years, I do see growth of more hospitals.
Yeah.
I see within the existing hospitals growth of more lines of specialization. And I see...
So we expect to see new players in the market.
Correct. You are going to see new players in the market. At the level at which they come in...
Is the market not saturated?
Not, because you have a situation where you have, again, when you have a medical tourism hub, you have expanded your market base. So whereas we may have been serving 30 or 40 million Kenyans a few years ago, now in East Africa there are 150 million. So the more the catchment grows, the players are expected to grow. So we will see. It's not going to be very aggressive, because remember, investing in hospitals is a major barrier to entry, because it's a huge investment. So the same way you haven't seen that many new hospitals even since independence, it's a gradual process that you will begin to see. So you may see 1 or 2 new players coming into the market over the next 5 to 10 years. But the existing players will also improve in terms of specialization, especially our own strategic plan at Karen Hospital is to deepen, to go deep and go wide. And by that I mean the specializations we currently offer, like cardiology, orthopedics, oncology, go more and more detailed, get more and more subspecialized, get more and more latest equipment, increase the number of specializations as well, to be able to serve a wider market. That is the general trend with hospitals, and they will tend to grow from level 3, 4. So you may find a primary hospital is maybe able to provide not many specializations, increasing their level of categorization. Remember, each hospital has a category as per Ministry of Health based on the specializations they're able to provide, all the way to teaching. The ultimate is where you're able to teach, and that becomes now quite a specialized hospital.
Very good.
Of which we are in. So you will see more and more. So we'll see more specializations, but you will see more visitors because of these initiatives to bring in more tourists. So we expect growth in medical tourism over the next 5 years.
Very good. And we hope that you know, all the local players, you know, will be up to the challenge, and of course grow with the time.
Yes.
Gentlemen, your time is is highly appreciated, because we have come to the end of this conversation at exactly 10:59.
Thank you very much.
You remain dismissed.
Thank you for hosting
In a
us.
polite way.
Thank you very much. Thank you.
Well, you've been watching this conversation live from Broadcasting House. Our conversation has been around medical tourism, and we have been in the company of Edwin Kegode, who is the General Manager, Managed Medicare at how do you pronounce it? At Minet Kenya, yes, that's right. And Dr. Ernest Mureithi, who is the head of doctors at Karen Hospital, you know, giving us tips and bits on how to drive the growth of this industry here in Kenya. Well, the first hour is down. We're now getting ready for the second hour, and our conversation is around trends in the real estate industry, from affordable housing to access. All that conversation will take place here. My name is Kimani, and you're watching This Check.